to RevMD, a podcast created for healthcare professionals by healthcare professionals. We will share tips on medical billing and coding, as well as workflow optimization to help practices succeed, thrive, and grow revenue. All right, excited to be back for another podcast. So this week, I'm actually going to be doing this alongside a PowerPoint. So if you found this on our podcast website, certainly head to RevMD Facebook group. That's REVMD Facebook group, or email me at heather@nationalrevenueconsulting.com. We are working to get these updated to our website, and we'll share that information in the next podcast or so. All right, so before we get started, I wanted to share a story. I was at a medical conference a few months ago and was sitting around with a group of physicians and kind of sharing stories over the last few years. And a physician sat down and he shared that he hadn't been paid in 12 months and kind of like really curious about why that was. And so he shared that the reason was that his medical biller was not using their data analytics, right? That was not sharing the data to look at their claims, to look at, rejection rates and denial rates. And so he really didn't have any visibility. And so while he thought everything was fine, he really didn't know for sure. And after a few months, obviously he realized revenue wasn't coming in, and they kept going back and forth trying to improve things. Lo and behold, it took him 12 months to truly start making an income again. Now, certainly didn't take him 12 months to realize something was going on, but took him a long time to recover the mistakes that were made. Now, obviously, there are struggles with medical billing that occur sometimes, but I truly believe that if you have a really close pulse on the data, that you can catch something sooner and correct for it. And so when listening to that story, that was really the why behind wanting to help physicians teach about medical billing and coding, teach about the data that you should be watching so that your private practice can thrive. With that, I'm going to turn over to the PowerPoint. Just a quick disclosure. So this is for educational purposes, of course. This has been created from a team of people who have over 30 years of combined clinical software and billing experience. As always, please consult your medical billing and coding team should you have questions about your own process. And if you're looking for a recommendation or a new medical biller or coder, please don't hesitate to reach out. My email is heather@nationalrevenueconsulting.com. So let's first start by just talking about medical coding as a general definition. So this is really the process of translating what we do clinically into a standard language, so to speak, that allows for insurance carriers to understand what was done in a standard way so that they can then pay per a fee schedule. Now, regardless how we feel about insurance companies, it is not only our reality, but more importantly, it's actually also our patient's reality. So there are two types of medical payments. So there's the professional side, which is really for the physician or provider, and then the facility side, which is, payments to the hospital, to the outpatient surgery center. And some of these payments are also called technical fees, which we'll get more in detail regarding the laboratory space, which has to do with technically cutting, for example, histology slides in the laboratory. For the next slide, I want to talk a little bit about just the definitions or the types of codes. There are two types of kind of coding terms that are important to understand. So there's the ICD-10 codes, which stand for the International Classification of Disease. And we are on the 10th version, but seems like 11 may not be too far away. So the ICD-10 codes themselves also fall into two categories, and you'll see those listed underneath. There are the clinical modification or CM codes, which are really diagnostic codes. And then there are the procedure coding system, PCS, which are really the procedural codes just for hospitals. So again, ICD-10 codes come in two flavors, right? ICD-10 CM and ICD-10 PCS. Now, let's talk about CPT codes or HCPCS codes. So HCPCS codes stand for Healthcare Common Procedure Coding System, which consists of CPT codes. Basically, both of these types of codes are just procedure or office visit codes. Nothing in either of these systems is used for diagnosis. Now, HCPCS codes come in different levels, and level 1 is actually comprised of the CPT codes. And these are maintained by the AMA. Now, level 2 HCPCS codes are more about supplies and services and drugs that really aren't addressed in level 1. It's important to know that modifiers are used to be added to certain procedure codes, whether that be HCPCS or CPT codes. Now, I won't go into detail on that today, but that will be for another day. So again, to summarize, we've got ICD-10 codes, which are broken up into clinical modification codes or diagnostic codes. And this is where we'll spend the most of our time today. Then we've got procedure codes, ICD-10 procedure codes, right? So those are procedural codes for the hospital, again, all under ICD-10. Then we've got the HCPCS CPT codes, which are just procedures, and those are used by both physicians as well as hospitals. So if we go to the next slide, we can get a little bit more specific around the structure of ICD-10 codes. So there are actually a ton of ICD-10 codes, over 72,000. So I will echo that these are not to be memorized, just want the general understanding so that if you're looking these up in your EMR, you understand kind of the general rules, especially when it comes to how specific you need to be with regards to an ICD-10 code so that you get maximum reimbursement as well as no errors or rejected claims. On the left-hand side, you'll see kind of the structure of the ICD-10 code. They always begin with a letter, and the letter is then followed by 2 numbers. So those first three characters are called the category, or kind of define the category of the ICD-10 code. Then you'll see a decimal point, right? And then the next 3 characters can either be letters or numbers. And that gets more specific when it comes to the diagnosis. It's a subcategory, it's an anatomic site, it's talking about severity of the disease. And so again, that's the next 3 characters. The 7th character is not always present, but the 7th character is there as an extension. And we'll talk about that in a minute. It's important to recognize that you don't necessarily see all of these 4 characters after the decimal point. But if you do see them, they are increasing the specificity of the diagnosis. On the right-hand side is just a simple table showing the difference between the ICD-9 codes and the ICD-10 codes. We, again, are in the ICD-10 code right now, and it sounds like 11 may or may not be coming up soon. And so it kind of lists out the difference between the 9th version and the 10th version, which isn't entirely important. It's just there for reference. But really, I think just understanding that, there can be up to 7 characters for the ICD-10 codes, and that with additional characters means increasing specificity for that diagnosis. So if we go into the next slide, here are some examples. Note that codes with 4, 5, 6, or even 7 characters, again, are increasing the specificity, which you can see increasing specificity as you go down the list of the ICD-10 codes that are there on the screen. You want to be aware that some codes require a certain level of specificity if you are able to have that, if you have that information clinically, meaning if you can get to that level of specificity, you should do that with your diagnosis. Don't just pick the first drop down for diabetes on your in your EMR. Actually look at all of the choices and make sure that you're selecting the correct one, because it does impact reimbursement. If you look at K26.1, which is the diagnosis acute duodenal ulcer with perforation, you'll note that K26 stands for acute duodenal ulcer, and then the .1 is the portion that stands for with perforation. And so again, I won't read all of these, but you'll see increasing specificity as the number of characters grows. And you'll even see the one on the bottom, M80.021G, which has that 7th character and is extremely specific when it comes to that diagnosis. All right, we'll do a little review on the next slide. Again, most EMRs have a lookup feature. Certainly don't memorize any of these. ICD-10 codes start with a letter followed by 2 numbers, which defines a category or a similar type disease, right? And then additional characters after the decimal point will further subcategorize a diagnosis. And with increasing characters, increases the specificity regarding the diagnosis. And you can see an example on the right-hand side of one of the diabetes categories. And with increasing characters, you can see increasing specificity. So E13.0, other specified diabetes with hyperosmolality. Now, if you add another decimal, or excuse me, another character down below, you'll see that we're now starting to talk about more specifics around the diagnosis, such as whether or not there's ketoacidosis with or without coma. All right, so the next slide just further expands some additional diabetes, ICD-10 codes. Again, just for reference, showing again, the differences when you've adding additional characters, getting more specific with regards to with or without macular edema, and then continuing to add characters to even go as far as that 6th character and that 7th character showing laterality. All right, next slide. Let's talk about that 7th character. So you can see that sometimes codes get to that 7th character and sometimes they don't. We saw that on the last slide with regards to the diabetes diagnoses. So I just want to stress that you can't actually ignore that 7th character because sometimes it's necessary in order for you to get paid. This is especially true when you're talking about injuries or poisonings, and I'll show you an example of that in a second. So there are many categories that, again, require that 7th character, and oftentimes they have 3 specific options that you're trying to describe, say, for example, an injury or a poisoning. You're trying to describe, an initial counter, which has the letter A. The letter D can be used as that 7th character, which stands for subsequent encounter, or the letter S, which stands for sequela, which also could be used as an option for that 7th character. So A stands for that initial character, which is defining the stage of the disease where the patient is still receiving active treatment. The letter D, when it's stating subsequent encounter, that's actually talking about the stage of disease after the active phase of treatment, when the patient is receiving just routine care for that injury. And the letter S in that 7th character stands for sequela again, which defines if there have been complications as a result of the initial condition. So examples of this are seen in chapter 19 and then also chapter 15, which is pregnancy. So chapter 19 is that, again, injury and poisoning section, which I'll show you an example here. All right, so next slide. Let's talk about that placeholder X character. So sometimes in an ICD-10 code, and again, I'll also show you an example of this on the right-hand side, sometimes you need a placeholder in order to, quote unquote, get to that additional character or digit. And so oftentimes, say in the chapter around injury or poisoning, you want to describe the state of the injury, again, based on that initial encounter, subsequent encounter, sequela on that 7th character, but you don't have enough characters to get you there. So then you'll need to have some placeholders, X, for example, to get you, quote unquote, to that 7th character. And so why I say this, again, not to memorize all the ICD-10 codes, because it's certainly not what I'm saying, but that way, if you're in the EMR, right, and you're trying to select a diagnosis and you see the X's, it's important to make sure that you select the ones that correspond to what you're trying to describe, and that you don't ignore the X's if you're writing something in, for example, because they could be invalid or considered inaccurate. On the right-hand side, we have an example where T18.1, so foreign body in the esophagus. T18.100 is basically saying there's an unspecified foreign body in the esophagus, which is causing compression of the trachea. It further asks for you to define, again, that seventh character, whether or not this is an initial encounter, is the patient in active treatment? Is it a subsequent encounter, meaning that active phase has already passed and we're now just getting routine care for the injury? Or is this, or are we in the sequela phase, meaning we're treating the patient for a sequela of the foreign body in the esophagus? Now you'll note that T18.2 is now talking about foreign bodies in the stomach, but say they don't have as many examples or diagnoses, I should say, in order to have as many characters to get to that seventh character. So they put the X's as a place marker so that, again, we can still describe those seventh character attributes, but don't have to have the fifth and the sixth character. So you'll see the T18.2XXA. So again, we're able to say it's a foreign body in the stomach and it's an initial encounter, meaning patients actively getting treated, and so forth. So again, X's mean something, don't ignore them. Essentially, it's a way for us to either allow for future expansion of the ICD-10 codes or to quote unquote, get you to that seventh character. All right, next slide. This is have a little fun. There are actually some pretty absurd codes out there. So when I was putting this together, I ran across a few that I thought were pretty funny. Again, tens of thousands of ICD-10 codes, and some of them are very specific. V97.33XD, sucked into a jet engine, subsequent encounter. Now we've got another one, pedestrian on foot injured in collision with roller skate. Yes, roller skate, subsequent encounter. Now there's also another one called struck by a duck, subsequent encounter. And then my favorite, problems in relationships with in-laws, is another one. Now I love my in-laws. I have no issues with my in-laws, but still pretty hilarious. So not sure any of us have probably ever used these, but thought they were at least funny to add. Let's last talk about maximizing reimbursement. So why are we even talking about this, right? Like I said earlier, two reasons, right? We want to be able to make sure that we've got accurate medical billing and coding to maximize our own revenue, also to be able to manage patient questions and be advocates for them. But learning these basics helps us kind of really understand when we're looking up the codes, which one to choose and which one makes sense. All right, like I said before, these are all in your EMRs or in a coding book. So certainly don't memorize any of these. And I highly recommend using a practice management software and EMR software that has coding features built in. If it's not it still can be done in the coding books, but just not as efficient. Always just be aware that there are annual and biannual updates for medical billing and coding, and also what's called the NCCI edits by CMS, which come out in January, which really has to do with bundling and unbundling codes, which we'll go through in a different course. Also, don't just pick the first code you see that seems to be close when you've got the drop-down menu. We've all been there, right? We don't really know what we're doing. We drop down, we type in diabetes, we select the first one we see. Lo and behold, there are many different categories of diagnoses within the diabetes chapter. So make sure that you can get as specific as possible. If there are coding rules that tell you how specific you have to get, make sure that you pay attention to those. Again, if there is a need to add that seventh character, it's an option. Don't leave it off. Certainly, adding that when it's necessary is going to keep those claims from being rejected and help you get additional revenue. Also know the difference between that initial, subsequent, and sequela definitions for that seventh character. They're not super intuitive, so just make sure you kind of really understand that. Know when to use the placeholder X in a code, meaning if you see a drop-down menu in your EMR and it gives you an ICD-10 code that's got a whole bunch of X's, know at least what that means and that it's something to make sure that you include. And last but not least, when in doubt, of course, look up the explanation or ask a certified coder. Again, if you guys need a recommendation for a medical bill encoder, please don't hesitate to reach out. And let me know if you guys need anything. Thanks for listening. I know this isn't the most exciting topic, but it helps us better understand how to code and diagnose to continue to increase your revenue. Thanks for joining today. We are starting a movement. If healthcare professionals understand the complexities of medical billing and insurance reimbursement, we can be advocates for our patients and grow our own revenue. If you like this podcast, share it on Facebook and invite others to the Facebook group RevMD.